Welcome everyone to today's program, the Dental School Experience, sponsored by ASDA and the ADA. I'm Brooke Kachuris, ASDA's Membership Development Specialist here at the Central Office in Chicago. Now, before we begin, note that all attendees are muted so that we don't pick up any background noise during the program. During the presentation, you'll be able to ask questions of the presenters. You'll notice a control panel on the right side of your screen. You can type into the question box at any time, and at the end, we'll try to answer as many questions as we can. We'll also provide contact information for the presenters if you would like to email them directly. I'd like to introduce our moderator for tonight's webinar, Michael Chen. Michael is a member of our Predental Advisory Committee.
The Predental Advisory Committee has been working hard to bring ASDA Predental some great resources to kick off the membership year. We have tonight's the start of webinar Wednesdays, special mouthing off posts, Instagram challenges with prizes, Instagram takeovers, a new manual dexterity Pinterest board, and some other surprises. So enjoy the month and bring your friends to catch ASDA Fever, which is also this week's Instagram challenge. Now, I would like to welcome today's speakers. So first up, we have Paul, is a fourth-year student at Oregon Health and Sciences University, where he serves as Class of 2019 President. He is the ASDA District 10 Trustee, past President of SPEA, and just finished his term on the Oregon Dental Association Board of Trustees. Brandon is a former pre-dent turned full-blown third-year dental student at Creighton University. He currently serves as both the chapter president of ASDA at Creighton University, as well as the ASDA's District 8 trustee. The decision to choose dentistry as a career didn't come easy for him, but was the best decision he ever made. Now he wants to help predentals like you crush predental life so you can crush the dental school life and eventually even crush the dental life. And then we have Talene. She is currently a second-year dental student at the University of Connecticut School of Dental Medicine. She has been involved in ASDA for over 4 years now, dating back to her time spent serving as the District 1 Predental Committee co-chair during her undergraduate studies. And additionally, last year, she served as her first-year class representative and now serves as one of the second delegates for UConn ASDA. So to start it off, what is dental school really like? Paul, do you have any thoughts?
All right, what is dental school really like? Well, first of all, it's going to be the absolute best 4 years that you've ever had, but simultaneously, it will be the most difficult 4 years of your life. What it's really like really boils down to a matter of where you are in the program as well as what school you go to. So I'll speak kind of to my school, which is OHSU out in Oregon. When we start out as a D1, it's science, 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 science. And the pace that we tackle science at is much greater and much more in depth than you do in undergrad. So like in undergrad, you have a class like cell metabolism and you do like glycolysis and Krebs cycle and all that stuff. That's like one lecture in dental school. So it's you have to do a lot of study. You have to keep on top of a lot of different classes. In our second year, we become more focused on our simulation clinic where we're working on our hand skills, learning to cut preparations, make dentures, do endo, all sorts of stuff on plastic teeth, which prepares us for a third year where we move in, we start seeing patients and performing these procedures. At the same time, we'll attend classes and go a little bit more in depth, which then of course prepares us for our fourth year, which is the best year because basically all you do is perform dentistry, and that's why we're here. So I have 1 or 2 classes on like ethics and advanced endo techniques, but most of my time I'm in the clinic treating patients. So it's a wild ride. Buckle in.
Great to hear. Brandon or Talene, do you have anything to add?
No,
Not really.
No, pretty much covered it.
Great. All right, so moving on. What are the classes like? Brandon, can you talk a little bit about that?
Sure. So Paul really touched on a lot of this already, but I guess as far as classes, it's really not like undergrad where you maybe have 3 classes, a day, if that. It's for most schools, it's really, it's like 8 a.m. till 5 p.m. depending on which year and during times that can be better or worse. And one of the weird things about dental school versus maybe some of the other graduate level programs is there's a lot of lab work involved. So you might be taking, you might be taking 4 hours worth of didactic work during the day, and then maybe have a 4-hour lab in the afternoon where you're just doing lab work. And then who knows, maybe you didn't finish your lab work then and you're working a few hours after class for that lab work too. Every single year is a little bit more different. The first year really seems to be your classic book sciences. It's all of your anatomy, your histology, especially that first semester tends to be very general, your biochemistry, physiology. You start to get, as you kind of progress, things start to be more dentistry-like. You get into your head and neck anatomy, which is a little cooler, your oral histology, your oral pathology. But you're still, especially that first year, is really just a lot more book work. At least at our school, I think every school is a little different. We do have dental anatomy and dental materials, which just gives you a very basic layout of how, of the very basic like sciences of dentistry as far as like the anatomy of your teeth and just the very basics, but it doesn't really go super in depth as far as actual dentistry. Second year, you get a lot more of that. Your lab classes, you do your endo lab classes, your denture lab classes, your operative lab classes. You do get exposure to more of the dental side, but then on top of it, you also still have your didactic work. At most schools, it seems like the second year seems to be the busiest just because there's an extensive amount of lab work as well as an extensive amount of didactic work. And then like Paul was saying, by your third and fourth year, it tends to get increasingly more clinic heavy. By your fourth year, maybe you're doing more rotations and maybe a lot less didactic work at all. And it probably varies dramatically by school. I know Talene has a little bit of a different experience with how her school is run.
Yeah, Talene, do you want to talk a little bit about?
Yeah, so I go to UConn, like mentioned before, and I'm currently a second-year student. So I'm actually the second class at UConn Dental, who is completing our biomedical curriculum alongside our medical school colleagues. So most dental schools will have a 2-year biomedical curriculum, whereas I'm the second class to have our biomedical classes condensed into, I think, 15 months. So I actually have 4.5 weeks left, but I'm not counting. And then, it's great because then we can get into the clinics earlier and try and get more clinical experience. So it has its pros and cons. It is a lot of studying outside of class time, but so far I like it.
Great. Thanks for those answers. Very quickly, can you guys speak to, do you have any recommendations for any sort of classes that you would want any pre-dental students to prepare for? There seems to be such a broad range.
I think looking back, I went to Boston University and there was a gross anatomy class that was offered. So if anything, I wish I took more anatomy classes, because coming into dental school and just diving full on into the dissections was interesting, obviously, but there is a lot of prep work outside. So I think if you have the chance to take any anatomy classes, definitely take advantage of those opportunities.
I would also say I took like a medical biology undergrad, which did have that gross anatomy and histology. And so that really did help me a lot with that first year. Another way to look at it too, that some of my classmates have done, is exploring other things too, like getting like business education. Most dentists will graduate to be practice owners of some form or partners. So getting that experience in business, because you won't get a whole lot of it in dental school, can be really good. So there are other, you get that question asked all the time by pre-dentals, like what should I be doing, before dental school starts? And sometimes it's not just, you're probably smart enough already to do the didactic work in dental school. Sometimes trying to explore other topics that you don't expect, like business, could be even more beneficial.
Yeah.
Dentistry, it's kind of like one part scientist, one part engineer, but also one part artist. So something I think gets overlooked, art classes, sculpting, drawing, these are skills that you really have to rely on a lot in dentistry that maybe you didn't have the training. I certainly didn't before I got in. So if I had to do it over again, I definitely would take smart classes, some sculpting, things like that.
Great. Thanks on touching on those classes. So moving on, how does dental school differ from undergraduate? Tallene, you're the closest, I think, to undergraduate, so maybe you want to speak about this.
Yeah, so kind of piggybacking off what Brandon said, you know, we all apply to dental school, you need the same prerequisite classes, so everyone kind of comes in on the same playing field, all having taken, you know, bio, the chem, etc. So I would say that one of the main differences once you're coming to dental school is that you're taking more classes that you're actually passionate about, whereas in undergrad, I know sometimes you have to follow certain classes that coincide with your major and whatnot. So you'll definitely find yourself being more passionate about what you're learning, which makes you want to study more. But then you also are studying more. So definitely practicing better time management, I would say. You are also probably going to want to be involved in more clubs and activities and whatnot, and different shadowing and mentorship programs. So I would say, you know, maybe try and refocus your priorities and your responsibilities, because also you're not living in a dorm anymore, so you're gonna not be able to crawl to the dining hall. So just kind of, yeah, like refocusing your priorities and time management will definitely help you succeed for the differences that you'll feel weighing down on you your first year.
I wouldn't mind adding too, you're going to be really, really close with your classmates. That's something I guess I didn't really think about when I got into dental school. In undergrad, you know, you're separated from, you know, every single class is a totally different group of people, usually depending on what school you went to. With dental school, you are going to be with those people like Monday through Friday, all day long, usually even after class. Like you will get really, really close with them, that you develop like this family with them. That was something that was very different in dental school than from undergrad. For mostly good and sometimes bad too, but mostly really, really good.
Great. I think going off of that as well, Tallene, you talked about some of your extracurriculars that you got more involved in once you got to dental school. At the undergraduate level, what kind of activities do you think students can get involved with that align with the values of a dentist?
Yeah, so I mean, kind of going off what Paul said, try and exploring different realms of your interests that you might not have had time to explore in your academics. So I know some of my friends were in like the a cappella groups or even a photography club, and also balancing it obviously with some volunteer opportunities and stuff like that. But you do want to also try and cater your time towards your interests. That way you're, you know, balancing out your time and your interests and whatnot. So.
Great, thanks. All right, so let's moving on. How much studying is there in dental school? Tallene, do you want to take this as well?
Sure. So this is kind of a relative question, I would say, because every school is different in their structures and whatnot. So my experience is obviously different from theirs. I know the first 15 months is the med school curriculum, so it is kind of front loaded. It depends on the week. Also, different weeks will have different topics, and you'll have different labs, like was mentioned. You know, one week you might just be doing a simple class 1, but then the next week might be a class 2. So it just kind of depends on the week and the school, I would say. But I mean, personally for me, the busier I am, the more productive I am. So studying is kind of just part of the ride. And, you know, everyone's doing it with you too. So it doesn't feel as, you know, stressful as maybe it would have felt in undergrad. Also, one of the major differences that I forgot to mention in the last question was I do not recommend trying to cram for an exam 2 nights before, like you might have been able to pull off in undergrad, because it will not work in dental school. But yeah, that's what I have to say for that.
And I know for Paul and Brandon, who are entering clinic in their 3rd and 4th years, how is studying like for you in the second half of dental school?
Well, I think eventually you hit this part in dental school where there's like a convergence point where suddenly it's like all the stuff that you've been doing comes together and you're almost studying every class at the same time, because you're working with a patient. You have to take into consideration like what medications they're on. So there's your pharmacology and your chemistry, and you have to consider their health conditions. So there's your anatomy and your physiology. So it becomes to a point where almost everything you're doing is studying in a way.
I would also say it's gonna vary dramatically from person to person. There are some people who can like get away with very little studying, other people who need a lot more studying. There are some people who are like amazing at bookwork, but maybe they struggle with their hands, or there's some people that struggle with their hands and struggle with lab and have to spend a lot more time in there, but maybe they, and vice versa. But there's also those people that are awesome at everything. Yeah, I don't know, but every single person is totally different. Some people are notorious crammers. I'm a notorious crammer. I always wait till like the last day to study, and I do get away with it, but I'd never recommend that to anybody because it makes for a miserable day the next day, and a lot of stress. So yeah, I definitely think, especially from a Predent standpoint, when you get in, try to develop your baseline. So just like study your butt off as hard as you can, like right when you get in there. Just assume basically that first test is going to totally kick your butt, and just study the world for it. And then you can kind of develop and determine like how much you're going to need. And you will like get to know the different classes that you're good at and what you can study for and what you can't, what's going to take you a long time, and you'll get the hang of it.
Great, thanks. So speaking of clinic and a shift in studying habits, when do I get to work with patients when I'm in dental school?
Oh, is that me? Okay. So yeah, it kind of, this is another one that varies by school a little bit, but there's kind of a general trend. At my school, we get to kind of start doing like cleanings our second year. I know that's pretty common in a lot of schools. Maybe they'll do cleanings. Maybe they will even do some denture type related activities with patients. A lot of shadowing starts to happen your second year, and maybe even your first year for that. But usually across the board, most schools are, doing daily clinic sessions by their third year.
At OHSU, we really stress trying to get into the clinic early, and we'll have our first year dental students will do a lot of assisting. So they're not necessarily working on the patient, but they're working with an older student with the patient. And they'll do really kind of some low impact stuff like head and neck exams, really basic cleanings, just trying to build that kind of patient-doctor communication early.
Yeah, that sounds really valuable. Can you guys talk about some of your first patient experiences? I'm sure that must be a big transition from going from learning about everything to applying it in the clinic. I think that'd be valuable to hear.
It's the first time, it's terrifying, honestly. It really is. You're used to dealing with like, non-existent mannequins and like reading books. And then all of a sudden you have this like living, breathing human that feels pain, and you can't just like take their head and like rotate it 180 degrees anymore. So you're like, it is really terrifying. Despite the last 2 years of like studying and all the classes you take, you go and have like the simplest appointment your first day of clinic, and you're like, crap, I have no idea what I'm doing. And you have to like swallow your pride and like develop a sense of like humility and just like ask for a lot of help and like ask questions along the way. Hopefully your patients are understanding of that. Most patients, they know they're going to a dental school, and a lot of them have been going to it for years, so they understand the process. So in my experience, I've had mostly really great patients. Of course, there's always the troublemaker patient every now and then. But yeah, I've had mostly good experiences, and it's just mostly getting over the fear and putting in the reps until you get comfortable to start doing the procedures, and just understand that it's a learning experience, and don't be too hard on yourself.
And then it's also something that turns out to be very rewarding. There's nothing quite like, you have a patient that comes in and they have complaint, or they're missing a tooth or something, and you spend all this time working up an implant for them or doing this bridge, and you place it, and then suddenly they're super happy with it, and you get to feel like all this work that you've done is paid off. It's there's nothing like it. I mean, dentistry is the only place that you can really see that. If you're a surgeon and you give someone a new hip, it's not like you're ever really going to see it again. We get to see that stuff every day.
Great. Yeah, that patient interaction must be very special. So speaking of patients and working with other people in dental school, aside from all the academics and the clinics, will I be able to have a social life or a life outside of dental school? Paul?
No.
No.
No, I'm kidding. The way that you get into dental school is being very, very good at time management. So it's something that to get through dental school, you have to be good at time management, and you have to start booking in your social activities. You got to make time for it. Otherwise, you're going to get stressed out. You have to have a work-life balance. So we find times for that. Things that could be as simple as just keeping active, going to the gym, going on hikes, going out with your friends on the weekend. There's this really great organization, I don't know if you've heard of it, it's called ASDA, but it gives you a lot of opportunities to interact with dental students from literally across the country, put on conferences and things. It's I'm so glad that I got into ASDA. ASDA is definitely getting me through dental school.
I would add that honestly, I have more of a social life in dental school than I ever did, really. And I'm not joking. Just because like you'll have this group of 8, depending on how big your class is, but you'll have a group of 80 students, and after every exam, people want to go out and celebrate, or it's always somebody's birthday, or there's always something going on. If you're a member of ASDA, there's always a conference or social or something happening. So depending on the circumstance, you can there's always time for social activities. And also everyone else around you, like in your social group, is going through the same thing. So like if there's an exam, no one's doing anything, but when there's a free period, everyone's like down to do things, usually. At least that's how it is for my class. So I feel like I've had a pretty strong social life, and even with being as busy as I am with ASDA and everything else, I think it's so important to find time to just hang out and chill, and there is time for it, and you will find time if that's something you value.
Yeah, I agree with Brandon. At UConn, our class size is under 50, so you really do get to know everybody. And like he mentioned earlier, everyone is going through the same thing. Everyone has their highs and lows coinciding with their schedules. So you really are all together, and it's a really good support system. But it doesn't just stop with your school. Like Paul said, ASDA is nationwide, so there's countless people that are there to help you and do fun things with you.
That's a relief to hear. I think social life is a very important part of wellness, which we all strive for. Speaking of wellness, yes. For financial wellness, if I'm worried about finances in dental school, do I need to have a supplemental job? Is it possible? Do people even do that? Tallene, do you want to talk about this a little bit?
Sure. So, everyone is coming from a different background, so it's hard to, say yes or no on that. But in terms of like a resume standpoint, it's not really necessary. You can find other ways to get involved if you are worried about, finding that time to commit to a job. But in terms of financial reasons, I think it also depends on the school and the rigor, and also the year in school that you're in, because it does kind of come in waves. Like I said, personally, I do not have a job. I spend my time outside of school, involved in ASDA and doing other volunteer work and stuff like that. But 2 of my roommates actually do have jobs, and they found jobs where they can work as receptionists at the school gym, so they're able to do their work while they're doing that. So I think it definitely is possible if you feel like it's something that you need to do. You just might have to, cater it towards your schedule and whatnot. There are also some students I know that do waitressing and stuff like that. So it's definitely feasible. You just have to chunk it out and time manage, and you'll be fine.
A lot of other people will do jobs, maybe like assisting at a local dental office or doing research, things like that, where there's more flexibility and there's maybe kind of an understanding that you're in dental school. If you're going to have a job, that would be the way to do it. But the way I see it is dental school is a full-time job. You're there on most days from 8 a.m. till 5 p.m. So it's hard to find a job that's going to be of value to you that won't require you to sacrifice your commitments to dental school. So not too many people have jobs other than maybe summer jobs or things like that.
If possible, marry rich.
Yeah, I think that makes sense. I think it comes down about the job. It comes down to time management and understanding where we are and what we need to do. Great. So I know that for pre-dental students going through undergraduate, some people will apply right after school. Some people will apply between junior and senior year. If you're in dental school and you decide to pursue specialty, how do I or anyone start the process of choosing a specialty? Brandon, do you want to touch upon that?
Sure. So I would say first, the most important thing as like a first year starting dental school is to keep your mind open. Don't be the person that says, oh, I'm going to be an oral surgeon. I'm going to be an orthodontist. Oh, I want to, and also don't close yourself off the other way. Maybe don't say like, I don't want to specialize at all either. I would say just like do your best to get good grades, do your best to like keep your options open and explore things, especially that first and second year. The most important thing should be, if you're curious about that, would be to do some shadowing, asking around, maybe talking to upperclassmen who are going through the process, talking to faculty members who might understand the different departments, going to department heads for the different specialties at your school. That would be the most important thing right off the bat. I don't plan to specialize, so I don't know all the details necessarily as far as what you do as you get along the way. But as you kind of get through dental school, there's more tests usually that you have to take to kind of help determine that you're an applicant for the specialty programs, and usually they'll want a greater number of I don't know, requirements, or I don't know what they want, but they want stuff from you. It's harder. You have to have better grades and all those things to specialize. So as far as just starting the process, though, I think the most important thing would be to find mentors, find people to talk to that have gone through the process, and keep an open mind.
Paul, do you have anything to add as a fourth year student, you or your classmates?
Yeah, similar to what Brandon said, and I also I plan to specialize in dentistry. I'm not smart enough to get into anything else. I kid. What you really want to do is you want to talk to people that have been through that, whether that's if you're at a dental school that has residency programs, talk to your residents. Otherwise, talk to the specialists in your local area or at your school. Ask them what being a periodontist is like, what they do. Ask to shadow them. It's another step. It's more commitment. It's more time, and you want to make sure it's something that you really want to do before you go for it.
And is the timeline anything like applying to dental school? Do people apply during school? Do people apply afterwards?
Usually apply late in your third year.
It all depends. Some are like requiring like a GPR beforehand or not, different programs. Every program has their own thing. So it can be, and that's a general practice residency for those that don't know what a GPR is, which is still general dentistry, but it's a residency yeah.
Great. Sounds like there's a lot of options. Speaking of options, when I'm in dental school and in there, and thinking about my life after dental school, whether it be specialty or otherwise, what are my options after dental school, and when should I start planning for these? Paul, do you want to speak about that?
Yeah, definitely. So step one, get into dental school. That should be your primary focus at the beginning. Once you get into dental school, like immediately when you get in, start thinking about what you want to do afterwards, because the 4 years, it goes really quick. We kind of talked about the specialties, and again, it's going to come down to, talking to residents, talking to specialists, shadowing, finding out is endo what I want to do for the rest of my life? Is pediatrics what I want to do? But you have a lot of opportunities to go in different directions with dentistry. You could go into, say, like a traditional group practice. You could be an associate. You could, stake your flag, build your building, practice and transition in that way. There's a lot of dental service organizations. You could work for them. There's opportunities to work within the military. You could do a GPR, which Brandon mentioned, or an AAGD, which is like a 2-year GPR, where they're just more focused case, more complex, medically complicated patients. They often are in conjunction with hospital rotations. So there's a lot of different ways that you should go, and you should start at least considering all those options in your first year and finding out what's out there and what interests you. So over the next 3 years, you can start looking into it to narrow that list down. If you guys like webinars, and I think you might, path that goes really into detail on some of these things that you should check out.
Wow, that sounds like a lot of options. Speaking with those options, is there any way during dental school that I can be exposed to learning about these? Are there different events? Will people come to the dental school to talk about these opportunities?
There's this organization called ASDA, and they put on conferences that introduce you to a lot of these options. Most of the chapters do things with various organizations. Like at my school, we do what's called Lunch and Learns. So we'll have representatives from our state association come in and talk about what private practice looks like. We'll have representatives of companies, like some of the bigger dental service organizations will come in and talk about their practice model and how they work. So we definitely, part of ASDA is to expose everyone to all the different options of how to practice. So ASDA is really your one-stop shop for that.
Great.
A lot of schools have their own like study clubs too. So there are like sometimes business study clubs, or oral surgery study clubs, ortho study clubs, perio study clubs. So if you think you might be interested in that, you can go and check out some of the other study clubs and get a little more exposure to that.
That's a good point.
All right, great. Thank you, everyone. We're going to open up everything for a Q&A right now. Remember, everyone, there is the question box off to the side if you'd like to ask our panelists a question. The first one that came in says, how many semesters of organic chemistry do you recommend?
I loved Orgo, so I'll speak to that. So I think most dental schools require Orgo 1 and 2, at least that's when I was applying, and that's in conjunction also with a lab. So 2 semesters with a lab, and I think we should be good to go. Paul, you're saying 3?
Yeah, for where I went to undergrad, we had to do 3 to get into biochemistry, which was required for OHSU. And I'm a chemistry nerd. Like I have my own safety glasses at home and everything. So I'd recommend, do as much OChem, biochem, PChem if you want to get really crazy as you can.
And I am normal and do not like chemistry. So I say do as little chemistry as you can to possibly get into dental school. But also their advice is good too.
I think also using the ASDA guide to dental school and just seeing the different requirements that some of the schools may have, that's a great option too, because if you like a region where some of the dental schools are, you can kind of cater it that way and see what different requirements each school has, because it does vary slightly from school to school. So that's also definitely something that you should be looking at while you're still in college and, planning out the rest of your years and your classwork.
Okay, next question. Paul, what kind of extracurricular activities are there in dental school?
In dental school, we have a lot of different things. At OHSU, we have a lot of intramural sports. We have a really cool basketball team from my class that's called Brachial Plexus. We were state champions last year. So there's opportunities to do things like that. There's also a lot of groups. I know Brandon mentioned like interest groups for the various specialties, but we have like a fly fishing group. We have a hacky sack enthusiast group. So we're in conjunction with like our medical school and our nursing school and our PA program. So a lot of these groups are interprofessional. So it gives us a chance to, work and do events with people in the wider healthcare community, not just the dental school.
Do schools frown upon shadowing specialists?
get as much exposure in dentistry as you can.
It could frown on if you only like
Yeah.
shadow specialist, or if you like went into your interview and were like, I'm gonna be an orthodontist and that's all I care about. Like they will probably frown upon that. But
Yeah.
if you did a lot of hours with a specialist as well as had some exposure to, you know, a general or whatever, then no, I don't think shouldn't be any problem.
A secondary question to that, do you need to shadow a dentist during dental school?
So it depends on what your purpose is. Like if you're gonna go into a specialty, if you're considering applying to say pediatrics, like spending some time shadowing a pediatric dentist is probably a good idea. Also, like when you're trying to get a job, looking for associateships, going out and shadowing to get an idea of if you like the office and want to work there is a good idea as well.
I know at UConn we have a mentor program where we're required to shadow like 3 times, I think, during our first year, and then it kind of just shifts into the second year. So I think just kind of helps us build relationships, like Paul was saying, with different health professionals in the area. So it also just kind of depends on your school and, you know, the requirements of your school.
So this is a question for all three of you, and I don't know, maybe we'll start with Brandon. What are some things you are proud about your dental school or that makes your school unique?
So our dental school has no residencies, so our clinical experience is really awesome. We do a lot of more complex cases, a lot of cases that would normally be referred out to specialists. We do a lot of like third molar extractions. We do a lot of molar endo. You know, just a lot of our requirements tend to be quite a bit higher, and we tend to get a lot of awesome exposure. We have a brand new school, which is really, really cool. A lot of new technology, new windows, which are nice. And then also we wear ties every single day. We have to wear dress clothes every day. We're like one of 2 schools in the country that do that. So that's always kind of a surprise. So this is actually literally what I wore to school today.
Oh, what about you?
So I'll give a shout out really quick. We have the best endodontic program in the country, according to me. So thank you, Dr. Witten. The other thing that my school is very, very focused on is sending us out in our 4th year on external rotations. We spend almost an entire term out at a community clinic doing dentistry, and our school is currently trying to work to increase that to more and more weeks. So you do a lot of what you might say like practice ready dentistry by going out in the community, seeing, you know, 6, 7 patients a day versus the like 1 or 2 that you normally see in dental school.
Eileen?
Yeah, so at UConn, I mentioned this before, but we are combined with the medical students for our biomed classes. So we kind of are taught the importance of practicing interprofessionalism from, you know, day one. So I think that's really important as healthcare kind of shifts going forward. And also we have a 99% match rate for our residency program at UConn, which is pretty awesome and something to be proud of. So yeah, and it's a small school, so you got that really close family feel.
Are any dental school classes online?
We have a couple online classes at our school. They're usually classes like the history of dentistry or just, you know, how to use the library services or things like that. So not a lot, but there are just a couple.
I wouldn't say we have online classes, but we might sometimes have like pre-recorded online lectures, but it would never be a full class, like course, I mean.
Is there a required GPA for dental school?
It's one of those things, it's often school dependent. If you go on to any of the dental school's websites, you can usually find the entering statistics of their previous class. And then if you want to go to that school, you should shoot to have comparable stats to that and GPA, DAT scores, etc. I think our school, like the average is right around 3.5 for science. But you know, there's people that have above that and people that have below that.
I think for most schools, usually the science GPA is usually higher, if I'm remembering, than the overall GPA, as obviously you need a strong science foundation. But also the guide to dental school that I mentioned before kind of outlines all the different credentials for each school. So that's a good resource because everything's all in one place. And also they update it year to year. So that's also something that I strongly recommend you use.
I know a person that had like a 2.0 GPA and got into dental school. There are other ways to make your, application. If you can prove that if you can prove it in other ways, whether it's your DAT or your volunteerism or whatever else, or maybe going back and doing like a master's or something, a bad GPA doesn't always kill you.
Mm-hmm.
So the whole application is increasingly more important.
What's the difference between DMD and DDS?
Nothing. They just mean different things. So it's Doctor of Dental Surgery, I think, and then Doctor of Dental Medicine.
If we
Both
want to
equally
do,
as qualifying.
if we want to do just a really quick history lesson, it used to be all DDS until Harvard made their dental school, and they actually do not award degrees unless they're in Latin. So they were awarding a CMD, which changed to a DMD, and then now there's a lot of schools that do DMD, a lot of that do DDS, but it's the same. We all do the same thing.
Unless you ask people at Harvard, then DMD is the greatest. David Dinesh. Just kidding.
Any quick DAT tips?
So long ago.
Make a study plan and try and stick with that. That way, each day or however long you're going to study, you have a plan. You don't start studying and then you kind of get frustrated with yourself, or if it's a topic that you may not be strong at, and then just kind of give up for the day. So I say, try and make a to-do list each day and try and stick with that. And just make sure you have enough time, and also don't be too hard on yourself if you do end up pushing it back.
I think I used like DAT boot camp and it was amazing.
Mm-hmm. And crack DAT I used also.
I used Orgo Man.
And don't let SND?
SDN.
DN, there you go. Don't let them discourage you, because you're going to get someone that's going to be like,
Right.
oh no, I got a 29 on my DAT. Should I retake it? I don't think I'm going to get in. So just don't be like that.
Just don't read it.
Do you ever hear of students who drop out, and is burnout common?
I have a story about burnout. So last year we were at UConn we have 10-week blocks before our exam, which is a 7-hour exam. So it was like the week before our exam, and we were sitting in a lecture being taught about burnout. Well, we were all quite literally burnt out. So it does happen, but like we said earlier, it comes in waves. And there are a few classmates that have either dropped out or taken a year off, but that's up to them. And we all got here for the same reason, so it's completely fine.
Yeah, just to follow up on that, I think in almost every class since I've been at OHSU, there's been 1 or 2 students that have taken a year off or part of a year off and then rejoined the class below. I only know of one person that actually fully dropped out of dental school just because they felt like they couldn't do it.
It's not very common.
All right, so we're going to go through all 3 of you on this question. What's coming up for you in the next few weeks? Let's start with Haleen.
Finishing my med school curriculum.
Brandon?
So who?
You.
Brandon?
I'll be going to Hawaii for the ADA annual session as a delegate. That would be cool.
Paul, can you beat that?
I can, because I'm gonna go to school tomorrow and deliver 2 implants. I've got some perio and some stuff I'm doing next week, and then I'm going to join Brandon for a week in Hawaii for the ADA conference.
Nice.
All right, everyone, thank you so much. That's all the time we have for our questions. If you're looking for more predental focused learning, sign up for any of the upcoming Predental Month webinars. Or if you're looking for live ASDA learning experiences, you can register now for National Leadership Conference in Chicago. Registration is open through mid-October. We'd like to thank you for participating in tonight's program. I'd also like to thank our speakers, Paul, Brandon, and Taylene, for presenting for us tonight. This program was recorded and it will be posted on ASDA's website and emailed to all participants. Complete the evaluation by Friday and you will be registered for a drawing to receive an ASDA water bottle. Thank you so much for joining us. Register for the next week's Wednesday webinar or join in on social media throughout the month and enjoy the rest of Predental Month. Have a great night, everyone. Thanks so much.
Good luck, everyone.
Thank you. Good luck.